for patients watching this segment who are hearing about what's going on at Vanderbilt, where you're working very closely together, tight collaboration between pathology, imaging, radiation, medical oncology, how does a patient who may be treated in a community hospital, how do they know what to ask for? Is it appropriate, do you think, for a patient to go to their physician who's taking care of them and say, well, has my case been discussed at a multidisciplinary team meeting? Can it be? Should they be asking for maybe a reread of slides? What do we tell the patients? How do we get the message back to patients who are watching this segment looking for guidance for their particular tumour and management?
Well, I think it's appropriate for a patient to ask their physician just about anything. And it's important for the patient to feel like they have confidence in their physicians. There are some cases that are relatively clear-cut, where the pathologist has no question as to what this diagnosis is. But there are those that are challenging. And many outside pathologists will often send their slides, whether or not we see the patient, to Vanderbilt for a second opinion interpretation, because so much does ride on that diagnosis. But I think it's entirely appropriate for a patient to say, you know, has my case been discussed at multidisciplinary clinic? There's no harm in that. I think it would be fine.
Do you think for patients who are in the early phases of their cancer journey, where they may have already had imaging but not necessarily have a biopsy, if you were advising patients who are watching this segment, do you think it's okay to get the biopsy local to where they may live and say, once you've got a diagnosis, then maybe go to a centre of excellence? Or would you advise patients even early on, no, go to a centre of excellence even earlier to get that biopsy done, so maybe they get more tissue or better quality tissue or more markers? I mean, at what point does the patient need to plug into a centre of excellence? Is it before biopsy? Do you think there's value in that?
I think it depends on their level of concern. You know, there are a lot of great doctors out in the community, and sometimes having the biopsy and the tissue diagnosis helps us figure out which doctor at Vanderbilt they should see. You know, if a colon cancer patient came into my clinic, I would basically say, nice to meet you, but I need to get you in to see one of my colleagues because this is not the tumor type that I treat. But as long as there's skilled folks at a community hospital that are going to be able to get that tissue, I think that we're doing a better job of getting the information out there that this is important, that it's perfectly fine to have the biopsy closer to home. That's often a procedure that will require someone drive you home.
Right.
So maybe that patient is okay to come to the cancer center on their own and not family take off multiple days of work. So it really depends on each individual patient on what their family and they're comfortable with and capable of doing.
Evan, before we talk about mutations and the big buzzword of PD-L1 that's coming into management of many cancers, just to give us a sort of rough summary, when you're sitting in these meetings and the cases are presented, do you see errors with, typically, is it with delayed diagnosis? Is it bad management? Is it delay in getting patients into clinical trials and maybe off standard of care? Where do you see the errors in management or diagnosis in patients who may not have been managed in centres of excellence, and so that we can learn how we can improve care for patients by getting into the right centres?
Well, I would say that timeliness is important, you know, once a patient has a suspicion of lung cancer, from then the clock's ticking. And I've seen situations where patients have languished, not getting the workup as quickly or as
So even
appropriately.
after diagnosis, they have a confirmed diagnosis of lung cancer, but then there's further delays, yes?
All throughout the spectrum, even from imaging to biopsy, from biopsy to referral. I would say that is sometimes the biggest challenge that I see in getting patients to the appropriate care.